This is my pneumonia objective study sheet. Number 1, define pneumonia infection involving the lungs and infection has reached gas exchange area. Define pneumonia. Infection involving the lungs and infection has reached the gas exchange area. Define pneumonia. Infection involving the lungs and infection has reached the gas exchange area. Identify sequential events of pathology of pneumonitis. Bug gets in, inflammatory process to kill invader. Identify sequential events of pathology of pneumonitis. Bug gets in, inflammatory process to kill invader. Identify mortality in the U.S. for pneumonia. 60,000 people die in the U.S. and it's the 8th leading cause. Identify mortality for pneumonia in the U.S. 60,000 people in the U.S. and 8th leading cause of death. Incidences in the U.S. requiring hospitalization, 600,000. Incidences in the U.S. acquiring hospitalization for pneumonia is 600,000. 600,000 people require hospitalization a year for pneumonia, and 60,000 people die. It's the 8th leading cause of death for pneumonia. Identify different types of organisms involved in pneumonia: bacteria, viral, fungal, and protozoa. Identify different types of organisms involved with pneumonia: bacterial, viral, and fungal, and protozoa. Of the following bacteria, identify its classification. Gram-positive, Streptococcus, Staphylococcal, MRSA. Gram-positive, Streptococcus, Staphylococcal, MRSA. Streptococcus, gram-positive, most common community-acquired pneumonia. Streptococcus, gram-positive, is the most common community-acquired pneumonia. Staphylococcal, gram-positive, it's known for morphing. Staphylococcal, gram-positive, is known for morphing. Staphylococcal, morphing. MRSA, methicillin-resistant Staphylococcus aureus, gram-positive. MRSA, methicillin-resistant Staphylococcus aureus. Gram-negative, Klebsiella, Pseudomonas aeruginosa, Haemophilus influenza, Legionella, Chlamydia, Psittaci. Klebsiella, gram-negative, aerobic, found in GI tract. Klebsiella, gram-negative, found in GI tract. Pseudomonas aeruginosa, found in GI tract, green, sweet-smelling septum. Pseudomonas aeruginosa is found in the GI tract. Pseudomonas aeruginosa is known for sweet-smelling septum, found in the GI tract. Haemophilus influenza, acute epiglottis. Haemophilus influenza, acute epiglottis. Legionella lives in soil, found in standing water and ventilation systems. Legionella lives in soil, found in standing water and ventilation systems. Chlamydia Psittaci, carried in birds, transmitted to humans. Chlamydia Psittaci, carried in birds and transmitted to humans. Aerobic. Aerobic diseases hate oxygen. Aerobic diseases hate oxygen and are also often found in the GI tract or in your teeth. Aerobic. Peptococcus, Peptostreptococcus, bacteroids, Fusobacterium, Clostridium. Anaerobic. Peptococcus, Peptostreptococcus, bacteroids, and Clostridium. Clostridium, spore-forming, tetanus, botulism, gangrene. Clostridium, spore-forming, tetanus, botulism, and gangrene. Mycobacterium tuberculosis, acid-fast bacillus, TB, increased incidences second to AIDS. and homeless and alcoholism and drug abuse are to blame. Mycobacterium, tuberculosis, TB, acid-fast bacillus, TB, increased incidences second to AIDS and homelessness, alcoholism, and drug abuse. Rixetta, atypical, transmitted lice, ticks, fleas, Rocky Mountain spotty fever. Rixetta, atypical. Rixetta is transmitted by lice, ticks, fleas, and is known for Rocky Mountain spotted fever. Mycoplasma pneumonia, atypical, walking pneumonia. Mycoplasma pneumonia, walking pneumonia. Viruses. Influenza A and B, most common upper respiratory infection. Influenza A and B, most common upper respiratory infection. RSV, 25% of respiratory infections in children under 1 year. RSV, 25% of respiratory infections in children under 1 year. Parainfluenza croup, adenovirus related to fatal cases in children. Adenovirus related to fatal cases in children. Varicella chickenpox, cytomegalovirus, common with AIDS. Cytomegalovirus, common with AIDS. HIV, human immunodeficiency virus, precursor to AIDS. HIV, precursor to AIDS. HIV is a precursor to AIDS. Fungal. Recognize these terms in a lineup with emphasis on Candida and pneumocystis, pneumonia, PCP, or Javoki. Fungal. Histoplasma capsulatum, coccidioides, immitis, blastomyces, dermatitis, aspergillus, Candida albicans, Cryptococcus, pneumocystis, pneumonia, PCP, or Javoki. Fungal. Histoplasma capsulatum, coccidioides, immitis, blastomyces dermatitis, aspergillus, Candida albicans, Cryptococcus neoformans, pneumocystis, pneumonia, PCP, or Javoki. Those are all fungal infections. Fungal. Histoplasma coccidioides, blastomyces, aspergillus, Candida albicans, Cryptococcus, Javoki. Fungal. Histoplasma coccidioides, blastomyces, aspergillus, Candida albicans, Cryptococcus, Javoki. Pneumocystis pneumonia. Candida albicans is a yeast infection caused by steroids. Candida albicans is a yeast infection caused by steroids. Pneumocystis pneumonia, PCP, or Javoki. Javoki is associated with AIDS in immunosuppressed patients. Javoki is associated with AIDS in immunosuppressed patients. Define community-acquired pneumonia. Streptococcus. Define community-acquired pneumonia. Streptococcus. Understand patients assembled and symptomology, bacteria versus viruses. Bacteria, abrupt, productive cough, fever, increased white blood cells found in x-rays. Viruses, sore throat, abrupt, diffused, no white blood cell change, sore throat. Define empirical therapy, broad spectrum treatment. Define empirical therapy, broad spectrum treatment. Understand basic functions of diagnostic studies. Gram-stain A technique. Gram-stain is a technique for preliminary identification of bacteria. Gram-stain is a is a staining technique for preliminary identification of bacteria. Gram-stain is a technique for preliminary identification of bacteria. Culture and sensitivity: grow out the organism, see what it's sensitive to. Culture and sensitivity: grow out the organism and see what it is sensitive to. ELISA, enzyme-linked immunoabsorbent assay. ELISA, viral viruses, check for antibodies in a test well, check for color. ELISA, enzyme-linked immunoabsorbent assay. ELISA, viral viruses, check for antibodies in a test well, check for color. Identify 3 ways to obtain a septum sample for diagnostics testing. Septum induction, suctioning catheter, bronchoscopy. Identify 3 ways to obtain a septum sample for diagnostics testing. Sputum induction, suctioning catheter, bronchoscopy. Pneumocytosis, pneumonia, or Javoki is associated with AIDS, and it's also a fungus. Pneumocytosis, pneumonia, or Javoki is associated with AIDS, and it's also a fungus. Candida albicans is a yeast infection. It is associated with taking steroids, and it also is a fungus. Candida albicans is a yeast infection. It is a fungus. It is associated with taking steroids. Assessment between bacteria and viruses. Between bacteria and viruses. Dry, non-productive cough, virus. Dry, non-productive cough, virus. Highest temperature, bacteria. Highest temperature, bacteria, fever. Localized chest x-ray, bacteria. Localized chest x-ray, bacteria. Viruses diffuse. So, what has a local chest x-ray is bacteria. What has a quick onset? Both viruses and bacteria. Quick onset, both viruses and bacteria. Increased white blood cell count, bacteria. Bacteria has an increased white blood cell count. ELISA, enzyme-linked immunoabsorbent assay. Viral viruses, check for antibodies in a test well, check color. ELISA, enzyme-linked immunoabsorbent assay. Viral viruses, check for antibodies in a test well, and check for color. Culture and sensitivity, grow it out and see what antibodies kill it or it is sensitive to. Culture and sensitivity, grow it out and see what antibodies kill it or it is sensitive to. Gram-stain, quick identification on a slide. Gram-stain is a quick identification on a slide. Gram-positive turns purple. Gram-positive turns purple. Gram-positive turns purple. Gram-negative turns red. Gram-negative turns red. Gram-negative turns red. Mycobacterium acid fast. Do not take dye color. 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 How does an infection get into your lungs? Inhalation, aspiration, bloodstream transfer, direct and direct inoculation. How does an infection get into your lungs? Inhalation, aspiration, bloodstream transfer, direct inoculation. Empirical treatment, therapy initiated based on most likely cause. Broad spectrum treatment. Empirical therapy, treatment is initiated based on most likely cause, broad spectrum treatment. So that's it for this one. There's some more on here. I'm not going to go over them with you, but you can screenshot them if you want and review them on your own. There's a few more on the back. And this will conclude my video. Hope you all enjoyed. Hope it helps. Catch you on the next one. Peace.